different categories with mental health and fitness and all the different categories that make up our bariatric journey. But one of the biggest missing components out there is, who is the surgeon? Who is the person that we select to help us make one of the biggest life-altering changes that we will ever choose to make? So we are adding a brand new series called Meet the Surgeon. And in this series, we are going to bring you some of the highest cutting-edge surgeons in the bariatric industry. We are going to bring you people that are changing the way medicine is done out there. So with no further ado, I am excited to introduce to you a surgeon that will be joining us live from Arkansas. And I'm sharing with you right now on the screen his Instagram, because this is an Instagram that if you really want to understand the way bariatric medicine can take you down a lifelong journey, this is the Instagram you should be following. Here it is. Here it is, Roller Weight Loss. You're going to want to check this out on your Instagram feed. And then you're going to understand why when you are part of Team Roller or a member of the Roller family, how that is going to impact everything you're going to be doing on this bariatric journey. It is going to take you through nutrition. You're going to get live feeds that are happening right there in Dr. Roller's home. Not only will he cover nutrition with you, but throughout the journey, he is also going to be working in fitness. You'll get a little sneak peek to things that actually happen with members of his family. There's a little tic-tac that happens in that family every once in a while. But what you're also going to understand through this conversation with Dr. Roller is why it truly is a family. You're going to understand that his wife is also a doctor in his practice. So with no further ado, live right now from Arkansas, we are going to welcome Dr. Roller to the Celebrate family. Good afternoon, Dr. Roller.
Hey, how's it going?
It is great. How are you?
Doing well. Doing really well. Glad to be here. Thanks for having me.
Of course. So the first thing I want to do is just introduce you. I want to just tell everyone that's going to join us and catch the replay of this video exactly who Dr. Roller is. Can you share with us a little bit about yourself personally?
Sure. So I actually am an Okie. I was born and raised in Oklahoma. Grew up in Tulsa. Went to OU for undergrad, and then went to medical school at OU, and then that's where I met my wife. And then we went down to Dallas at UT Southwestern for our general surgery training, and Kristen did her family practice training there. Amazing experience. I mean, Dallas was just really busy. There was tons of surgery, tons of trauma. It was about my fourth year in residency, I decided I wanted to pursue minimally invasive surgery. So fortunately, I was able to get into a fellowship at Duke University Medical Center, where I did advanced laparoscopic general surgery and bariatric surgery. And it was at that time I decided I need to be a bariatric surgeon. And that was back in 2007. We moved to Fayetteville, Arkansas right after that fellowship in 2008. That is where I had to beg and plead my wife to actually work with me and be our bariatrician. And after probably about 6 weeks, she gave in and decided to do it. And I think she'd tell you today it was the best decision she's made. So at that point, we started Roller Weight Loss and Advanced Surgery, and we've been going strong. So when we started, it was Kristen and myself and 3.5 employees. We had a part-time dietitian, a nurse, a receptionist, and an office manager. And we've now grown to, I think we're 50 plus employees. We have 4 surgeons, a bariatrician, we have 5 dietitians, offices in Fayetteville, Fort Smith, Tulsa. So it's gone really well. So we've been fortunate.
That is fantastic. So what do you enjoy the most about bariatric medicine? Like, I absolutely love that you and your wife are part of a team and you've built the family that is in there, but what do you enjoy the most out of that field of medicine?
Well, I would say, and this is what got me interested when I was at Duke, is the patients are happy. They're just happy. They come in and they're pretty miserable. You know, the weight has really got them down, not only medically, but physically and emotionally and mentally. And that can all change with one surgery and in 2 weeks. So when we, see them back at 2 weeks and they've lost 15, 20, 25 pounds. I mean, they're just happy. And so that was what I like the most and then you continue to follow them out to a year. And we tell our patients, just when you have surgery with us, you become part of the family. Your belly and I are married. We're going to see you for the rest of your life. And I still see patients that I did 13 years ago. And it's just been a real blessing for my wife and I to be able to do that.
That is fantastic, because a lot of times in the bariatric journey, people think about surgery as that short, small window of the actual procedure. And that's where I'd love to dive a little bit more into your practice and kind of break down the components of your practice. Because guys, we're going to provide a link right now in the notes of this video here on Facebook, where you actually can go to Dr. Roller's website and check out his practice, because the amount of information in there is just, you'll spend so much time on there and you really get to know, like, it is a beautiful website. But I want to take a little bit about your surgical career and break it down into the categories, because within your practice, you do advanced general surgery. Can you share a little bit about that?
Sure. So we'll do your basic, so for instance, gallbladders. That's something that happens in bariatric surgery about 10 to 12% of the time. And what we tell our patients is I put in specialized plumbing, and you don't want just anybody getting in there that could injure the plumbing. So we adopted a philosophy very early on. We would be taking care of that to protect, basically our patients. And not to mention, then we get into the world of advanced laparoscopic hernias, adrenalectomies, stomach cancers, colon cancers, big, huge hiatal hernias, paraesophageal hernias, those kind of things. And we do all of that laparoscopically. So I would say that's the overwhelming motto of our practice, is that we're going to do everything minimally invasive, tiny incisions, quick recovery times, no major scarring. And that's, I think, been the key to our success over these past 13 years.
And correct me if I'm wrong, but I do believe you're a leader in Arkansas for that. You have so many firsts that you led the path in Arkansas with minimally invasive and laparoscopic surgery. Is that correct? That's
correct. So when I got here, there just wasn't really anybody doing advanced laparoscopic general surgery. So it was fairly new to the state. So I've been fortunate to be the first to do a lot of these advanced laparoscopic procedures. From rectal surgery to common bile duct surgery. It's something that I trained in at Duke and at UT Southwestern in Dallas, but it just wasn't here. It was part of my attraction to the state too. The world of bariatric surgery here was, there just wasn't much of one, and I wanted to start my own program and build it the right way all the way up. And so that was, in the northwest corner of Arkansas is an amazing place to live. We have Walmart here, JB Hunt, Tyson Foods, University of Arkansas. It's a little bit of a tough decision not to go back to Oklahoma, but I was able to kind of justify a little bit, because Arkansas is red and white, OU's red and white. We both hate Texas, so
right.
It worked out well. I saw Boomer Sooner on the feed, so Boomer, back at you.
Yep, you've got the boomers in the house, that is for sure. But so let's move on, because a lot of people, when they are interested in bariatric surgery, they might not be ready for surgery. Maybe their insurance doesn't cover surgery. Maybe it's going to be a little bit more of a journey. I would love for you to share some of the non-surgical weight loss opportunities that Roller Medical offers, if you could talk a little to that.
Sure. So some people, as you said, they're just not ready. They haven't had that kind of aha moment where they go, okay, this is it. And generally those moments are, they've gone to Silver Dollar City, which is a amusement park around here, and the roller coaster doesn't close, or they're afraid to get on an airplane because they have to get a seatbelt extender. And we have those. And then there's the patient that maybe they're sitting there at a BMI of 37, 38, and they're just not sure that this is for them. So we offer the balloon, the endoscopic Orbera balloon. And that's a good procedure that kind of will make you go, one of two things is going to happen. You're going to do it and be successful, or you're going to do it and not be successful. And for those that are, great, you don't have to have surgery. And for those that aren't, then, that is the moment you can say, okay, I now know I need this help. I need the surgery. And I just encourage people to know that that's not a personal weakness. It's not a failure. Obesity is a disease. And, for any other disease, we seek doctors and surgeons and we get help for it. But for some reason with obesity, people are reluctant to go that route, and they shouldn't be, because our surgeries are so much better than they used to be 20 years ago, and people are doing so much better. So we have lots of options. We also have a medical weight loss program with our dietitians and our Dr. Kristen and our advanced practice nurses that can lead them through a non-medical approach as well.
Fantastic. And then let's talk about what you also are world-renowned known for, which is surgical weight loss. And there's something very unique about your practice because you don't just do one type of surgery. You include a library of surgery. Can you speak to the different procedures you do in your office?
Sure. So we do all of the weight loss surgeries that are out there. Our two biggest are the duodenal switch procedure, both the traditional and the modified versions, and then the gastric bypass. We do very little sleeve gastrectomies at this point. We follow our own patients, and so we know how they're doing. And our patients are looking for the most powerful procedures out there. They want to lose the most weight possible, and that is going to be with the duodenal switch procedure. And back in the day, that procedure's been out for 30 years. It just got a really bad reputation because the vitamin deficiencies and the malnutrition was terrible. But that's because they would bypass 95% of your small intestine. And I think we know now that is just way too much. So now we do that at about 300 centimeters from your colon. So about 55% of the intestine we bypass. And that seems to be really, really good number. We've been doing lots of duodenal switches at this point, and we don't really see malnutrition. We see excellent weight loss. We see them keeping it off, but it also has some of the nice advantages that are, you don't have with a gastric bypass, and that you can take NSAIDs, you can take steroids, and NSAIDs being like ibuprofen and whatnot. So it allows the patient to have a more broader selection of medicines they can take down the road, because joint pain, back pain, headaches, they still can happen. So in gastric bypass, I think is still a gold standard at this point. Sleeves we use for people that can't have one of those two, or maybe they're a lower BMI female and they don't have all the joint back pain. It's a good option there. We also do, we very rarely do the lap bands. We take way more of those out now than put in. And then the balloon procedure. So we're also, our accredited adolescent bariatric surgery center, and we'll take kids from 13 to, and our oldest has been 79. Both had gastric bypasses and did great. And their main thing when they came in is, I just don't want to use this walker anymore. Like, this is killing me. So they both did great, went home the next day, and they're off their walkers. And it's been good. But we're seeing a lot of success with the duodenal switch now. And it's probably 50% of what we do, and bypass being the other 50%.
Wow, that's fantastic. And what I enjoy as I explore your website is it really gives it a personal feel. It's not cookie cutter. It's not, oh, he does VSG, oh, he does RNY. It really allows you to get to know the patient and understand their needs, understand their medical history. You really customize the procedure for the outcome the patient's looking for, as well as meeting them where they are right now in their health. Now, one of the things I enjoy the most being a 15-year gastric bypass patient is you have another branch of medicine inside your office, which I kind of gave the tagline of Radiance, because you have a whole separate website that we're going to link up right now. And this speaks to me because I think back in the day, if I would have been a patient or a family member of Dr. Roller's, this would have taken me through the rest of my life. Not only would I be coming to you for long-term bariatric maintenance, but all those different areas of our life that we go through post-op surgical. Tell us a little bit about your Radiance division and what that includes.
So there's three main questions that we almost always get at our seminars that we do. And we still do live seminars. We have an online one that's really good. I love it, but there's still people that want to come and see the surgeons and talk to us and count our fingers and count our toes, be sure, that we're normal and nice. But there's three questions that we always get. And this is before surgery. What about loose skin? I don't want to look older. And what about hair loss? And so we try to make everything in our practice revolve around that bariatric patient. So I did a lot of research a few years back into minimally invasive skin tightening, because prior to that, the only treatment was cutting skin off. cutting it off your arm, cutting off your belly or your thighs. And, you know, we've seen enough of that here in Arkansas that after, you know, 8,000 plus cases that it comes with major scars, major downtime, major costs, and it just hurts. And you do this minimally invasive weight loss surgery on them, and now they're coming out with these giant scars. And so there's still some people that need to go that route because of the amount. But we looked into radio frequency assisted liposuction. And what that is called Bodytite, Face-Tite. It can be used anywhere on the body, but through just a couple little incisions on the arm, let's say, because, you know, everybody gets the skin on the arms, and I hate that. They're just 2 tiny incisions in the office, awake. I can do the Bodytite procedure, deliver the radio frequency energy, and that starts the skin to start tightening by producing more collagen. And that's, as we get older, we lose collagen. As we gain weight, we lose collagen. So now we're getting it back. Then we do liposuction to get the rest of that stubborn fat out, and you will see that skin just start to tighten. And so if you kind of look at weight loss surgery patients, they lose weight from the face down. So this is the first place they see it. 2 weeks after surgery, they'll come in and go, my friends already can tell. Well, they can tell because of your face. And then this becomes an issue in the arms and the belly and the thighs. So we still don't want people to think, hey, don't have weight loss surgery because of loose skin. We want them to think, if that's a concern of yours, we're going to be able to take care of it, and we're not going to have to do major excisional surgery to do it. So been doing it for about 2 years now, done hundreds of cases. It works really well, and there's really no downtime, again, in the office, and patients get their confidence back. When it comes to the face, and they say they don't want to look old, what that really has to do with is losing fat in our midface. And as we get older, we already lose fat there. And so when you have a patient that's got obesity, it's, you know, there's extra fat in their face, and then they lose that. Now they go from where they were they were actually looking probably a bit younger than their age, to even older because they lost all that. And so that's where Dr. Kristen will do Botox and fillers to restore volume here for that aging. So again, that's simple on the office stuff that can give people their confidence back. And then the last thing is hair thinning. Obviously the most important things are protein intake and getting your vitamins and supplements in. And I mean, we preach the heck out of vitamins and supplements, and the hair, skin, and nails products made by Celebrate are phenomenal. So for those patients, though, that do have some hair thinning and they're kind of, you know, it's bothersome to them, we do the PRP injections into the scalp to help kickstart that process. So, you know, everybody's got a different thing they're worried about prior to weight loss surgery. But those are the things that over 13 years are consistent across the board. Loose skin, I don't want to look old, what about my hair? And we are trying to address that now, instead of kind of my old philosophy, which was, oh, don't worry about that. You've lost the weight, your diabetes is gone, your high blood pressure is gone, kind of be happy. Well, it's a real deal. I mean, it weighs on people mentally. And so now we can take care of that with minimally invasive options.
And I think that's fantastic, because I can share with you that long-term down the path, you leave that bariatric surgeon and then you seek out medical professionals in other fields to help you raise the bar in your new lifestyle, in your new life. Like, you do vein therapy treatment. And that was something that I sought out after I had lost 165 pounds, and going to a different doctor and explaining the path that you've traveled. I had gastric bypass surgery. I lost this. It's like starting all over, but I can only imagine being inside your practice. You've been with me on that journey. You've watched me blossom into this new lifestyle. And now I'm getting a little more self-conscious. I want a little something here. And to be able to have that security with your team and the family inside your practice, and have the confidence level and be able to be open and honest about the transitions in your body. The thing I enjoyed the most about exploring your website and speaking with you prior is just the fact that I could see myself spending the rest of my life being maintained and living out my best life chapters ahead, all within your practice with the people that help me make those choices. So I think it's really important to move on and talk about your team, because you can't do all of this by yourself. And you mentioned that you have 5 doctors. Can you talk a little bit about your staff?
So we have an amazing staff, and without them, you know, it would be hard. It'd be impossible. And We've tried to, I think we have some of the best people in the country doing what they do, from our front office people. I mean, that's the first people to greet our patients when they come in, and they know the patients by name. Our back office people that do all the billing and that kind of stuff. I mean, they work with our patients, because insurance is a hugely difficult process to navigate. And so we're there to help fix those problems and take care of it. Our medical assistants and nurses they do a fantastic job, but what we really have is Dr. Kristen on doing the bariatrician part, and you come in, you see her head to toe physical, and then our team of nurse practitioners and PAs that work along with her. And they're they could go and do anything they wanted, but and a couple of them were doing family practice stuff prior to joining us. And after 7, 8, 9 years, they're not going back, because they love the changes that you can see in our patients. Again, they're happy. That is contagious. Being around happy patients is doctors, nurses, APNs, they want to be around that. And they love doing what we're doing. And I can't forget our dietitians. It's one thing a few years back, I decided that we needed to really make that one of the strongest parts of our program. And Matt Johnson is our head dietitian. And we've got Ann Marquardt, who she started with me 13 years ago. She was with a part-timer. She went away for a couple of years, but she came back, and we just have so much experience in that department. And our patients love it, to the point where, sometimes they'll come in and want to go see them, not us, which is great. That's great. And then we, all of our surgeons are fellowship trained, from Duke, from Stanford, from University of Washington, Seattle. Top notch. We've got 2 more coming this fall that I'm very excited about, and I think are going to add to our program a lot to deal with complex things like robotic and doing robotic incisional hernias and things of that nature. So, but you're right, veins is a big deal, and Dr. Kwan, one of my partners, does those. He does a great job. Again, minimally invasive, in the office, no downtime. Just can't beat that stuff.
You can't. And one of the things I enjoy the most about your website is if you go to the website, there's videos with all the surgeons. Like, I spent so much time meeting them all. I know that whenever I look for a doctor in any practice, I'm always attracted. Is there a picture of them? Can I hear them talk? Feeling that personal connection. Your website does that so beautifully. And I think we also need to mention, you briefly mentioned, but you do have 3 locations. So it's not just in Fayetteville. You have 3 separate offices, correct?
Correct. And I did that because we know that follow-up is critical for long-term success after weight loss surgery. And, people will drive for the surgeries, and they'll do that. But then we want them to be just as engaged in the follow-up process as the surgical part. And that is so important to maximizing weight loss, preventing complications, and then maintaining the weight loss and preventing weight regain. So being in Fort Smith, being in Tulsa, now it makes it easier for patients to get to us for that follow-up. And we have a full staff in each of those locations, and it's been good. But then we now, as we've grown, we have patients coming from across the country, from Georgia, I operated a few months ago on somebody from the Bronx, North Dakota, South Dakota, Michigan, Washington, Texas, you name it, they're coming. And so now that's kind of the next step with us being a destination center, is how to do that. And that's what's, so the COVID-19 has been a real issue, but the best thing that comes with that is hopefully telemedicine being here to stay. And that will help a lot with those people that are coming for a destination. And, we're one of 5 centers in the country that can do Walmart patients. That was a big thing we got last year, is the Employers Center of Excellence Network. And so we were really seeing a lot of people coming from a long distance. And Tyson Foods, we're the only people in Arkansas that can do those. So we got these major corporations bringing people in, and now we got to, adjust to that, because it's follow-up still important. Doesn't matter if you're in North Dakota, we still need you to follow up. And so we're finding really innovative ways to be able to do that.
And you actually have a great tab again on your website that really gives comfort to anybody that's going to travel to you. It literally caters and shows them exactly what the experience will be, how you're going to take care of them. Because a lot of times people think, oh, you know, a friend of mine, you know, maybe in Arkansas had, you know, surgery with Dr. Roller. I wish I lived there. I wish I could have that experience. And there is an entire section on your website devoted to how can you travel and come have surgery with us. And this is how we're going to take care of you. So if you're watching this video and you are thinking, he's amazing, and I would love to have my bariatric experience be there, and I'm going to be able to cater to everything in my future, it is so possible. It is so easy. Go check out that website and check out that link, because he literally spells it out for you step by step on how you can be a visiting patient. And I just think that that is just priceless. Now, I would love to pick your brain a little bit on your thoughts about supplementation for the long term. Can you share with us a little bit on what your thoughts are and why you created specifically an online store?
So, you know, when you have a gastric bypass or a duodenal switch or even a sleeve gastrectomy, your anatomy is different, and it's different forever. You need to be on supplements forever. We know that. If you don't, and the problem with people that stop taking their supplements is that by the time you start seeing the effects of that, it's too late. You're at end stage damage. It's kind of like osteoporosis. The time to treat osteoporosis is when you're young. It's not when you get it, because when you get it, it's too late. So we are hardcore about supplements. We use Celebrate. When I first started, we didn't. And I made these awesome little 3x5 cards and laminated them, did it all myself, and I'd hand them out to each patient. Said, be sure that, you know, your multivitamin has this, this, and this in it, and your calcium is this, this, and this. And, you know, I don't know if you've ever been to the supplement section at Walmart or Walgreens or anywhere, but when you hold that card up and you're starting to look at the back of a label, you can really realize it is a difficult process, and people are making bad choices. And it wasn't because they wanted to. It was just hard. You should not have to be a registered dietitian to buy a supplement. So that's why we decided to simplify it. And what I like most about the Celebrate line is that it's complete, it's thorough, and that there's options. And so, you know, people, I don't like vanilla. Okay, well, there's 5 other things you can choose, but you got to do one of them. And our people that do it don't have issues. And then you get into some more highly technical procedures like the duodenal switch, where the multivitamin needs A, D, E, and K in it. That's a different multivitamin. You're not going to get that in your generic supplement at GNC. So that has been critical. And so what it's done for us is it has simplified the approach for our patients. Okay, here's what you need to be on for right after surgery and then long term. Just pick one of these 6 things. It's easy. And, you know, we can do recurring shipping on our online store. So again, we went to the online store to answer your question because people were coming from further and further away. Well, how can you help them get what they need? And so we put a store on our website so they could do that. And then, you know, it's easy the first year because we see them 2 weeks, 6 weeks, 3 months, 6 months, 9 months, 12 months. But what if you run out at 10? You know, you don't have to make a drive back to the office to buy them. So now they can get on our website, order them, and they can be shipped. And we can sign them up for recurring shipping so they don't have to think about it every 3 months. It comes on their doorstep and it's there. And that's another way. Compliance is everything. And our job as doctors is to make it as easy as possible for our patients to be compliant. If you make it hard, they won't do it. I won't do it. If it's hard, I won't do it. So.
Right. And we all know that, especially right before surgery and right after surgery, whatever your doctor tells you is golden, because you are going to do this right. You want to be successful. You want to be healthy. You want to be long-term. So the fact that you supply that to your patients and you make it so easy, and they are confident that they're not standing in an aisle at Walmart or a drugstore or a grocery store trying to figure it out on their own, it makes it so much easier. At this point, we're going to share up another link, and this is going to take you directly to Dr. Roller's patient resource page. This is one of my favorite pages on his website because that's where you're going to find the doctor videos. That's where you're going to find the instructions for the out-of-town patients. There's a section on there, support groups. But most of all, The direct link we're giving you right now is a link that is going to let you see the before and afters. Because I always say with every amazing surgeon, there's walking billboards. All of us out there that have had this surgery, that are out there living happy, successful, long-term lives, we are literally walking billboards for our surgeons. And when you go to Dr. Roller's links, you are immediately going to see glowing patients, amazing before and afters, video testimonials. So there's a link being shared right now directly on our Facebook page that's going to take you to see those before and afters, because Dr. Roller can just keep sharing facts and telling you what they do, but it's that patient that you're going to trust, because from a patient to a patient, we're the ones that are going to share the reality of that amazing experience we had with Dr. Roller. So Dr. Roller, I know your time is precious, but I was hoping you could share with us a few thoughts on COVID and obesity. We're hearing so much in the news right now about obesity, and your website really has stepped up to the challenge. There's so much talk about telehealth, but your website, the minute you land on that homepage, you and your wife are immediately addressing all of the changes you're making to your practice, what telehealth means to you. You really are driving home the future of medicine. Can you share with us your thoughts?
Yeah, so I mean, one of our goals in our practice is to always stay ahead of. Is to always stay ahead of the curve. And telemedicine's been around, for years, but we've always been limited by insurance companies not wanting to pay for it. And then on top of that, you have to have, prior to this, a state license in which the patient resides, not where I'm at, but where the patient is. If I'm talking to somebody from Pennsylvania, I need to have a medical license there. Well, getting a medical license in all 50 states is impossible. So I think that's going to be the first change we see that comes out of all this. Is there has been red tape that needs to be lifted, and it finally has. Now, hopefully that stays. When it comes to the virus itself, what I think the biggest take-home message, if you look at who the highest risk patients are from this, it's the morbidly obese patients, the ones with diabetes, high blood pressure, heart disease, lung disease. And just morbid obesity. And so, we've always known, hey, you want to have the weight loss surgery, lose the weight to make your diabetes go away or not get it, to prevent heart attacks, to prevent strokes, to prevent cancer. But now we have this whole separate, you kind of want to prevent it now. So, if you get COVID or something along those lines, you're probably not going to die from it. And that's the thing. Morbid obesity is an independent risk factor for that virus and having a bad outcome. And so, too many people, they wait too long to have the surgery, and they come in and they're like, if I don't have the surgery, I'm going to die. And you're like, well, I know, but we're beyond the time where we can actually help. Right. We got to get people to where they're seeking help sooner, faster, so before they become high risk. And this COVID thing has been eye-opening to, I know, the bariatric surgeons saying, listen, hey, we can help. We can lower these people's risk factors, but we need the red tape to go away so we can get to it. So hopefully we'll be able to, in our state, we're supposed to be able to start operating again or May 4th. It's still not exactly clear how they're going to roll that out. But my hope is we're going, and we're going to start helping a lot of people really, really fast.
That's amazing. So everyone, we have so many people joining us. Thank you so much for joining us live. But I want to encourage you to head over to Instagram and follow Roller Weight Loss. I can't do you justice, Dr. Roller, in these few minutes you've spared for us. If they go to your Instagram, not only do they understand your practice, but they understand you, your family, and what Team Roller really means. You're going to understand. You're going to see before and afters. You're going to get all kinds of information. So I would send you directly to their Instagram. But
yeah, Instagram or Facebook page.
Facebook and Instagram, fantastic. But if someone is serious about getting started, we want to provide you with a link that will take you directly to how you can get into the system, how you can get signed up to do an information seminar, how you can do it virtually. So we're going to provide you that link right now if you're interested in exploring bariatric surgery or even getting to know the practice themselves. So we're going to give you up that link right now. And then I do believe, correct me if I'm wrong, Dr. Roller, next Thursday on April 30th at 6 p.m., they can join you live for a Q&A.
Yes. And so we did that last week with one of our patients who actually works for us now. And next week, we're going to have a special guest. Again, just answering people's questions about weight loss surgery. We want the process to be simplified. We want it to be easy. And we've found these live sessions people can tune in and they can ask questions. We can just answer them right then and there. And there's not a whole bunch of hustle and bustle. But if they are interested in our program, go to our website, watch our online seminar, and when you call, we'll call you. And Ronnie will kind of talk you through the process and get you started. We'll try to make it as easy as possible. We don't want it to be intimidating. It is a big decision, and we know it is intimidating to make it. But I promise you, once you walk through those front doors of ours, you'll realize it's a safe place. It's a fun place. It really is a team. And then I also give a shout out to my daughters. They do our cooking series. And what we're trying to show people in the cooking series that we're doing is that it's not hard to make the food at home. My 14-year-old and 11-year-old are doing it. And it takes a little bit of time, probably 30 to 40 minutes to prepare it. But the meals have been great, and they're good tips, and they have fun doing them. We have fun doing them. And so, if you want some information on easy meals to put together, it's on our Facebook and Instagram as well.
Yep. It's a wealth of knowledge. You're going to be there for a while once you go check them out, from the nutrition to the workouts. You see their entire family working out together. So, Dr. Roller, you really walk your talk. You really live the lifestyle that you are gifting to all your patients. So I really want to end this by thanking you for taking the time. We were really excited about the idea of being able to bring bariatric surgeons directly into people's homes as they're in quarantine right now. And it was such a pleasure to have you kick off this series with us. So thank you so much. So everybody, this is where I put you to work. This is where you have to do the job for us and for Dr. Roller. We at Celebrate believe that sharing is caring. And if you know anybody that lives in Fayetteville or Fort Smith or Tulsa, or just wants one of the best surgeons out there, tag them in the feed below. Share up this in your groups. If you have special bariatric groups or Facebook groups, share Dr. Roller. And even if you didn't have surgery with him, maybe you had bariatric surgery, but you live in that area, but you're looking for some fillers and some tightening and some other lifestyle choices, his practice is open to anyone, not just his patients. So Dr. Roller, thank you so much for joining me. I really appreciate it. And everyone, until next time, as always at Celebrate, we close this out by encouraging you to stay safe, stay healthy, and be kind to one another. That's it from us here at Celebrate. We look forward to seeing you on the next episode. Thank you, Dr. Roller.
Thank you.